Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Surgery for Dupuytrens-contracture. Introduction. Dupuytrens-contracture is a common condition that makes it more difficult to use the hand. Healthcare providers may recommend surgery for people suffering from Dupuytrens-contracture. If your healthcare provider recommends surgical treatment for your condition, the decision whether or not to have surgery is yours. This program explains Dupuytrens-contracture. It talks about the symptoms and causes of the disorder. It also explains the benefits and risks of surgery for Dupuytrens-contracture. Anatomy of the hand. The hand consists of many bones. The bones are separated by special hinges called joints. Muscles make the bones move on their joints. You can grip objects with your hand because of muscles located in the forearm. Each muscle is formed of two parts. The fleshy part of the muscle contracts and is the part that creates the movement of the bones. The tendon part of the muscle extends into the hand and attaches to the fingers. The muscles are attached to the bones of the forearms at the fleshy part. The muscles taper down and become tendons through the wrist and into the fingers, where they attach to the bones of the fingers. When the fleshy part of the muscle contracts, the tendon is pulled toward the forearm like a cable, and the fingers bend. Some of the tendons are covered by a special tube containing lubricating fluid. This allows smooth and painless movement. The tendons and their covering tubes are held in place by a specialized covering called a sheath. All the muscles and tendons of the palm are covered by a thick blanket of tissue called the palmar fascia. Symptoms and their causes. In Dupuytrens-contracture, the ring and little fingers are unable to straighten. Sometimes other fingers can also be affected. This is caused by the thickening of the palmar fascia, mainly in the area of the ring and little finger. Though the palmar fascia thickens and the fingers bend, the tendons can still work properly to create a grip. The reason for this abnormal thickening is unknown. A few risk factors have been identified that increase the risk of developing Dupuytrens-contracture. Not everybody who has one or more of these risk factors will necessarily have the disease. Also, not everybody with Dupuytrens-contracture will have any of these risk factors. The risk factors are family history, alcohol and tobacco use, diabetes.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Physical therapy and injection of steroids around the fascia can reduce the pain in early stages of Dupuytrens-contracture. In some cases, oral anti-inflammatory medications may be tried for reducing swelling. Radiation therapy is being studied as a way to slow down the progression of the disease. A minimally invasive procedure known as needle aponeurotomy can be done in a healthcare facility. During this procedure, the healthcare provider tries to break the cords of tissue that hold the fingers back using a needle. When all else fails, open surgical treatment may be needed. There are several open surgical treatments available. One less involved procedure is known as a subcutaneous fasciotomy. During this procedure, the surgeon uses a knife to break the cords of tissue holding the fingers back. It is similar to a needle aponeurotomy. Another surgery, which is much more involved, is called complete fasciectomy and skin grafting. During this surgery, the whole palmar fascia is taken out with the overlying skin. A skin graft is needed for such a surgery. This program discusses a simpler operation known as partial fasciectomy. Surgical treatment. The operation can be done under local, regional, or general anesthesia. The incision may be left open, requiring cleansing changes. The procedure usually takes an hour to an hour and a half. Your healthcare provider will decide the location of your incision depending on which fingers are involved. The surgical procedure aims at removing the thickened tissue. This frees the underlying tendons and helps with finger movements. This surgery is usually done as an outpatient operation, meaning the patient goes home the same day of the operation. Risks and complications. This operation is very safe with excellent results, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks related to anesthesia will be discussed with you in greater detail by your anesthesiologist. Some of the risks are seen in any type of surgery. These include 1. Infection, deep in the hand or at the skin level. 2. Bleeding. 3. Skin scar that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are also rare, but it is important to know about them. Small nerves may be injured, resulting in weakness, paralysis, and loss of feeling in the hand. The tendon may be injured, resulting in weakness of the hand. There is also the possibility that the operation may not help the symptoms and may even make them worse. You may not be able to completely straighten the fingers after the operation. After the surgery, your hand will be bandaged. Your healthcare provider will ask you to keep your hand elevated above the heart level to reduce swelling. If your wound is left open, you need to change the dressing. When you shower, you will need to cover the dressing with a plastic bag. Your healthcare provider will tell you how long it will take before you can go back to work. This depends on your age, type of work, your surgery, and other factors. Your healthcare provider will arrange a follow-up visit to examine the incision and remove any sutures. Your healthcare provider will indicate the hand rehabilitation program suitable for you. Physical therapy is important to achieve the best results.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. You use your fingers and thumbs to do everything from grasping objects to playing musical instruments to typing on a keyboard. When there is something wrong with them, it can make life difficult. In the hand, the tendons are covered by a layer of tissue called the palmar fascia. If the palmar fascia thickens, you may be unable to straighten one or more of your fingers. In Dupuytren's contracture, the ring and little fingers are unable to straighten. Sometimes other fingers can also be affected. This is caused by the thickening of the palmar fascia, mainly in the area of the ring and little finger. Hand surgery can help relieve your hand pain and improve the use of your hand when other non-surgical treatments fail. This operation is very safe with excellent results, but complications may happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.